Imagine waking up tomorrow morning with a brutal, throbbing migraine. The light hurts your eyes, every small sound feels like a hammer hitting your skull, and you feel nauseous. Your modern solution is simple. You walk to the kitchen, swallow 2 ibuprofen pills, and wait 30 minutes for the chemical compounds to quiet your nervous system. But on the timeline of human history, these synthetic painkillers are a brand new luxury. For 99% of our existence, humans had to endure headaches, sinus infections, and migraines, with no modern medicine, no dark air-conditioned rooms, and no pharmacy down the street. So, how did ancient humans actually cure a headache? And why did some of their prehistoric remedies pave the way for our most advanced modern medical technology? The first, most shocking cure in human history didn't involve herbs, teas, or rest. It involved physical surgery on the skull. Archaeologists digging up prehistoric graves across the globe, from Peru to France, have made a highly unsettling discovery. They have found thousands of human skulls dating back over 10,000 years with neat round holes drilled, scraped, or carved directly into the bone. This ancient medical practice is called trepanation. Today, we view drilling a hole into someone's head as an extreme, last resort neurosurgery. But in the Stone Age, it was a surprisingly common treatment for severe head pain, pressure, and mental distress. To our ancestors, a throbbing headache was often interpreted as a malevolent spirit or pressure trapped inside the skull. By using sharp flint stones to slowly scrape away a circular piece of bone, they believed they were opening a door to let the pressure or the spirit escape. What is truly remarkable is that this wasn't a death sentence. By examining the smoothed, rounded edges of the skull bone, scientists know that many of these prehistoric patients survived the surgery, their bone partially regrowing and healing. They lived for years afterward. It was a brutal, high-stakes headache cure, but in a world with zero anesthetics, it shows how desperate our ancestors were to escape the agony of a migraine. But if you weren't ready to have your skull scraped with a stone, ancient humans had highly effective botanical alternatives. And their most successful remedy was willow bark. For thousands of years, humans across different continents independently discovered that chewing on the bark of a willow tree or brewing it into a bitter tea could instantly relieve pain and bring down a fever. Neanderthals were doing it 50,000 years ago. Ancient Egyptians wrote about it on papyrus scrolls, and the Greek father of medicine, Hippocrates, prescribed it to women in labor. It wasn't magic, it was chemistry. Willow bark contains a natural compound called salicin. When you ingest it, your body metabolizes salicin into salicylic acid, the active chemical ingredient in modern aspirin. When you take an aspirin today, you are essentially swallowing a highly refined, synthetic version of the exact same willow bark tea our ancestors drank by the fire. But they also understood how to treat headaches physically by manipulating blood vessels. In ancient Egypt, doctors recognized that migraines were often accompanied by throbbing, swollen blood vessels in the temples. To treat this, they created thermal poultices. They would mix cold, wet clay or river mud with soothing herbs like coriander and chamomile, wrapping the cold mixture tightly around the patient's head with linen bandages. It was the original ice pack. The extreme cold constricted the swollen blood vessels, immediately reducing the throbbing pressure in the head. However, the most bizarre, seemingly unhinged headache cure in history belongs to the ancient Romans. In the 1st century, a Roman court physician named Scribonius Largus wrote a medical guide recommending a highly unusual treatment for chronic migraines: the torpedo fish. The torpedo fish is a species of electric ray native to the Mediterranean Sea, capable of delivering a powerful 70-volt electric shock. If a Roman patient had a severe headache, the doctor would place a live, squirming torpedo fish directly onto their forehead, leaving it there until the patient's head went completely numb. It sounds like pure medieval superstition, but biologically, this was the world's very first recorded form of electroconvulsive therapy. It is the exact same concept behind modern TENS machines and neuromodulation devices used by neurologists today to quiet overactive nerves during chronic migraines. We tend to view ancient medicine as a dark age of superstition, primitive tools, and useless rituals. But the deeper we look into our history, the more we realize that our ancestors were remarkably clever biologists. They didn't just guess, they observed, experimented, and discovered. They laid the foundations for modern pharmacy with willow bark, pioneered thermal therapy with cold clay, and even anticipated bioelectric nerve stimulation with electric fish. We built a modern world of clean pills and white hospitals, but we are still using the same basic biological strategies our ancestors discovered while staring into the embers of the cave fire, searching for a way to quiet the storm inside their heads.